Good morning. This is Andy Reese with Department on Disability Services. Um, People had asked last week if, when I share the data, I could share my screen, the data in the PowerPoint that we provided before. Um, so, Unfortunately, to date, we now have 270 people who have tested positive for coronavirus. As you can see from this chart, in the month of November, we had 11 new people test positive, which is higher than we had in September or October, both of which had 6 people test positive. Um, Infections by placement type. In host home, we have 5. You'll notice that's 1 more than we've had in prior months. In intermediate care facilities, 93, which is quite a few more. That is 6 more than we had a week ago. In natural homes, 25. Nursing homes, 2. Residential habilitation, 27. And supported living, 118. If there's any good news in the last couple of weeks, it is that in natural homes and residential habilitation, there have been no new COVID-19 cases. You can see here the infections by placement type. And I had also before put the death rate by placement type, but I also wanted to be clear, as people know, the number of people who we have had who have died, the number of people we have who have had COVID and have died is 36 at this point. However, of those, there are 28 who have been determined, who are presumed or confirmed to have died from COVID. And we are still awaiting determination by OCME on 7 of them, I believe, or 6, I'm sorry, on 6. So in intermediate care facilities to date, we've seen a 31% infection rate. In natural homes, it's at 2.7%. In residential habilitation, 24%. In supported living, 12.6%. And overall, with people supported by DDA, it's 11.24%. And so overall, of people supported by DDA, we've seen there's a 13.43% of people who had COVID have died. And actually confirmed COVID diagnoses, it's 10.45%, which is actually sort of in line with what we heard earlier in the pandemic about death rate for people who are at higher risk. For people in supported living, it's at 6.78%, and residential habilitation, 7.4%. Natural homes is very high, but I'm not, because of the lower number in natural homes, not as sure that early on we were capturing everyone. We began getting a fuller report through the Medicaid reports in July. And as people know, our real peak was April and May. Intermediate care facilities, it's been a 13% of people who have had COVID have died from presumed or confirmed COVID, and 17.39% of people who have had COVID have died. You can see here, if you have not called in, there's the sort of the curve that we have by placement type, and it's, what you see is, and what's helpful, I think, is that the numbers down below, in ICFs in the month of November, we have had 6 people, and 4 people in SL. There have been 11 new cases in November. 1 of them was in a host home. Those numbers are so low that it doesn't make sense to include them on the chart. But as you can see, that's quite a bump up in November. both in overall numbers and of real concern of people in intermediate care facilities, especially when we consider the prior slide about the higher risk of very serious outcomes, including death for people who are in ICFs. So people who required inpatient treatment by month of diagnosis, as of yesterday, we had 5 people in the hospital, one of whom died yesterday. In November, we had 4 people who required inpatient care, which, as you can see, in August and October, we had only 2, and in September, there were none. And this is the overall number of the 36 people who have been diagnosed with, people who have been, of the 270 people who've been diagnosed with COVID, 36 of those people have died. 7 of them died well after their COVID infection and well after they had presumably recovered from COVID. 2 people were confirmed to have died from other causes, and we are still awaiting the final determination for 6 people. And so if you look at just people where we've had confirmed or presumed COVID-related deaths, there was one in November. There were 2 deaths in November. One person had COVID months ago and then died in November, so we're awaiting the determination from OCME. Another person was admitted to the hospital with COVID-related pneumonia and died during that hospitalization. So that's included as presumed COVID. And as you can see, that it was April where we had the majority of these deaths. Out of this is 20 out of 28 people, 18. We lost 18 people in April and 8 people in May. Amongst our provider staff, we have seen a significant jump. To date, there are now 377 provider staff who have tested positive for COVID, 32 of whom work for more than one agency, and provider agencies have lost 8 staff related to COVID. What I think this really points to for us, and it's no secret as we look around the country, we are in the middle of things spiking again. I've said repeatedly, I think we cannot be complacent. We really have to continue. Everyone has to continue to be vigilant. With this, I thought it was like 27 new provider staff who were added to our list in the last 2 weeks. We have to be vigilant, not only at work with ensuring that we're following all PPE requirements, but also at home in our own lives, that we are using face covering, maintaining safe physical distance from people, regularly washing our hands, and that we are continuing to reinforce the need for these measures with the folks who are working in the placements, especially, some of the places with very vulnerable people. We've seen a number of staff in a couple of different placements where a number of staff have all tested positive. In one of those, almost everyone in the home also tested positive. Fortunately, to date, in another one, no one in that home has. We are monitoring closely along with DC Health. The provider is checking up on those folks regularly. And whenever there's an outbreak in a DC licensed facility, DC Health provides guidance on the steps to take in terms of continued monitoring of the people that live there. So as we think about the importance of this, we need to think about next week, as we know, is Thanksgiving. we've heard a lot of conversation, or at least I've heard a lot of conversation about how will people be spending their Thanksgiving next week. Remembering that in your own household, not having on a mask is fine. If people from outside your household come over, they need to be wearing a mask. It's hard to sit down to Thanksgiving dinner with a mask on. There is a strong recommendation from the CDC, from DC Health, that people should celebrate Thanksgiving with household members only. The one I heard recently was have Thanksgiving with just your household so that you can share New Year's with other people. And keeping in mind, it's not just you. Some of us are not going to be at risk for more serious outcomes, but are we then going to be around people who are? Or are we going to be around people who then are around people? This Wednesday at the mayor's press conference, Dr. Nesbitt provided a really good example of the reason to be so cautious of a person who, just a hypothetical person, because it was looking into the future, but who goes to brunch on Saturday with a group of friends, and then on Monday goes and gets tested, reports to her family, her whole extended family, I got tested and it's negative, when she gets the results on Wednesday. So I'm looking forward to seeing all of you for Thanksgiving. Celebrates Thanksgiving with her extended family, and then learns on Friday that the person who she had brunch with the prior Saturday, in fact, had COVID. What people need to keep in mind is there is that period of time that you may still test negative, but you may have contracted it. And so, testing too early, relying on that test and then letting down your guard. Having a negative test doesn't mean that you don't wear a mask, that you don't practice, safe physical distance, that you don't continue to wash your hands. All of those things continue to be essential. And so I just really hope that people will be reminded to follow those. We were talking immediately before this started about how, when you are able to have turkey, that you're then knocked out afterwards. And in that vein, we were expecting that next Friday there would not be a call. Next Friday is a work day, so I'm perfectly happy to have the call. So if people feel like they would really like to see a call, I think we can have one. But please just let us know in the chat if you would, if you feel strongly that you would still like to have next Friday's call. And especially with how things are moving along lately, that will be fine. As I said, we are working on Friday. And so, this is how I normally spend noon on Fridays. I have no problem with spending next Friday in this same way. But I think people come to see that day after Thanksgiving as a day to relax and do other things. I hope that you won't crowd into stores for Black Friday, and that people will, keep all of these things in mind in terms of ensuring safety. One of the other things I just want to make sure that people are reminded about, one of the concerns sometimes is that provider staff might not report being ill because they're concerned that they'll lose, that they're going to lose the money from working. And so they go to work but keep their mask on, thinking maybe it's not COVID. And especially this time of year, I just have allergies. As a reminder, if someone is sick in any way, if you have any of those symptoms that indicate COVID, which can be, this time of year can be very confusing, because as I say, there are lots of people who are having, allergies from all the leaves down on the ground or from other things that are out there right now. But if you're going to be going to work, it's essential that you know that you're healthy. The CARES Act provides a tax write-off for providers to give 2 weeks of paid COVID-related leave to any employee. And so I am hoping that all of our providers have made sure, first of all, that they're aware of this and that they're aware of how to do it, and then that they are making their employees aware. If you need to take time off, if you are not feeling well, if you're questioning whether you should come in, call in, because you can get those 2 weeks of leave, and it does not get charged against any other leave that the providers may be giving employees as a benefit. So, please make sure that you're aware of the provisions that are available under the CARES Act, and that you're making employees aware that this is available, so that they don't feel, when they're questioning their health, that they have to go in because, they still have bills to pay. People may know we also, just on sort of support issues for providers, we did send something out. The mayor announced this week the bridge fund that is available, and we sent something out for providers, particularly for our day providers, so that they could look into funds that might be available there to support them. That went out this week as soon as we received it, or as soon as we saw it on the Deputy Mayor for Planning and Economic Development's website. Next, I would just so we're coming up on the end of the year, January 1, EVV must be implemented, or else there is a cost in the Medicaid reimbursement rate for the district. And electronic visit verification is EVV, sorry. And so I had just asked Donald if he could say a few words about that and answer any questions that people might have, so that we make sure we're on track to implement, because as I say, we need to draw down all resources available for all of us. So if Donald Clark is available, to please share that. Thanks.
Yeah, thank you, Director Reese. Good afternoon, everyone. EVV training has been kicked off by DHCF. This is a very critical, important juncture of the project, and the end date for training is December the 5th. This requires for each provider to designate a staff to be the administrator for EVV system. Training starts off with that very role, administrator training. After administrators complete their training, they will actually receive a kit with their credentials. That's very important to set up your agency for EVV and for DSPs to be able to check in and check out using that system, as they are tasked with uploading or creating logins for EVV for your DSPs. There is another critical role within this training, which is the office staff. That's someone else you designate from your agency who will support your administrator with certain tasks, such as scheduling, billing, visit capturing with your DSPs. I have dumped into the chat a very long text of this, what I'm speaking to, along with the actual notification. I've been informed from DHCF, they sent out to providers with the finer details on your requirements for training, and most importantly, outlining registration instructions. Again, just to emphasize, supported living periodic only, with and without transportation, in-home supports, respite in-home only, personal care services are the services that are service providers who are required to be in compliance with EVV. At this time, this does exclude remote supports or any of those services I have mentioned that are provided remotely. And I think that is it for me. I wanted to share. I can give you an update, kind of like not of the same nature, but that Deputy Reese shared with numbers. As of this morning, 44 agencies have logged into that training system. Now, keep in mind that that includes beyond IDD waiver. So that is concerning in itself that, 44 to date. We have until December the 5th. I think we're all feeling the pressures of this project's deadline, but it has to get done. We have to get in compliance with this federal mandate. If you have any questions, please email evvinfo@dc.gov. and they will get back to you. And most importantly, we recently had the town hall, and some of the questions asked were very important because there are a lot of COVID-related scenarios that we can't fathom that occur to ensure the continuity of services and supports that we may need to take into account with this system. So I'd like to take this back to that EVV project team to make sure it meets those needs. Thank you, and everyone continue to stay safe. I'll take any questions. Those I cannot answer, I'll definitely bring back to the team and try to get back to you. Is there training for Sandata for DSPs? Yes, I'm informed that it's a very high level training. The real detailed training is really focused on administrative and the office staff and their roles with EVV. However, the training that will be forthcoming, I think will be no more than 30 minutes for DSPs, just to show them the nuances of checking in and out via the app or through the landline call-in number.
If there are any questions, if people could make sure and type them to everyone, not just to participants, because panelists don't see things that are just to participants. So if people have questions, please type to everyone and we can respond to those questions. Thanks.
Director Reese, can I take a moment to mention something to the providers? As you mentioned earlier, DC Health licensed facilities, we do respond to outbreaks at the healthcare facility team. However, I do want to mention that those providers who have supported living and non-DC Health licensed facilities may also request consultation from our DC Health EPI team that handles non-healthcare facilities. And I will put that link in the chat. So all those providers that have facilities that are not licensed by DC Health, if you have a positive employee, person supported, etc., and you'd like a consultation from DC Health EPI, please use the non-healthcare facility link that will be found in the chat right now. Thank you.
Thank you very much.
I see a question pop up. No, EVV does not apply to day programs. That was one of the questions. And another one was pertaining to alt EVV. No, the training I'm referring to does not apply to those providers who have chosen to use alternative EVV systems. They only have to take the aggregator training, and that info should also be in the link provided. If it is not, you can always email evvinfo@dc.gov.
And along the lines, while we're waiting for questions, along the lines where I was talking earlier about the importance of always practicing, the necessary measures about face coverings, keeping a distance from people, regularly washing your hands. DC Health had shared with us a little graphic that I think is helpful for people to keep in mind. Because, we are at home and think I'm okay because of I know who I'm around. And this is a good sort of reminder of, the people around you who you think, well, they're all safe, so I'm good because I know that none of them have, that they are taking all necessary precautions. But then they have contact with people who have contact with people. And, the thing that has really stuck with me early on in this was Dr. Fauci, who described COVID-19 as a very efficient virus. The transmission of this thing seems to be a very efficient transmission, which means it goes from person to person very easily. And So, we need to continue exercising caution around everyone, because we need to keep in mind, in my household, each of us goes into work. And so who are each of us around when we get to work? Well, I make sure that when I'm at work, I'm in my office by myself or I have a mask on. And, it goes on to the next level and the next level. And we all need to just continually remember to be cautious. So someone asked if it's possible to post COVID updates. In fact, the COVID updates are posted. If you go to coronavirus.dc.gov, it's not the same details, but it is the DDS data that is posted every day, and that is updated daily. If you look at coronavirus.dc.gov and look under data, you will see the data for DDS, which is updated, as I said, daily, 7 days a week.
Daryl had highlighted for providers that would like DC Health epi results for facilities not licensed by DC Health and have positive staff. So for those folks who are on the phone, you can go to dchealth.dc.gov to the COVID-19 reporting requirements to see that data.
So I don't know if this is a question, and maybe Donald can respond to it. We're still trying to conform to EVV deadlines. However, December is too short to do so.
Yeah, we've heard the same thing during the town hall. I always try to talk to DHCF team about that, but really this doesn't come locally. This is required through the federal government and mandated down. So we're just as much trying to implement this project within the timeline we're given, ultimately with EVV.
Any delay in implementation, quite literally, would require an act of Congress. Do we not have Sharon Mebane included as a panelist? Could she please be included there so that she can share some information?
Hi, everyone. Thank you, Director Reese. I just want to share that for licensed facilities, we are doing focused fundamental infection control surveys. And the surveys are especially those that have outbreaks. We consider outbreak of one or more. There are unannounced, and we are looking to ensure that you are following the guidance, and especially if you have been, if you have a positive, that you have instructions from EPI, that you are following those recommendations from EPI. I just want to let you know that we are conducting those surveys for both ICFs and also for ResHabs. Thank you.
And I would actually encourage our provider agencies, and I expect some are doing it already anyway. I'm hoping all are doing it already, but just as a reminder, for you to do your own pop-in visits with different placements to make sure that people are consistently implementing the required measures for infection control in any place that you're operating.
I see another question pertaining to EVV. I'll just read it out and answer it. How long after an agency has completed EVV agency overview training will the registration kit be received? I'll have to take this back. I was under the impression that once an administrator completes their training, that is automated and triggers the kit to be emailed to them. However, I'll follow up on that and try to provide some more detailed answers to that.
There's another EVV question for you, Donald.
I see it. There's an EVV training starting today at 1 p.m. The notifications do not specify the areas on the schedule. Can these notifications be more specific on which training is scheduled, on which day? I will send this request right away to to DHCF.
And there's one more.
We have completed agency overview training and identified the designee awaiting credentials to register for EVV system to begin entering trainees. Okay. I will send those two updates to them.
Someone says they got their agency login information within 24 hours. Okay. So perhaps if someone else completed it and they didn't, they might want to contact that email address you gave them earlier.
Yeah, evvinfo@dc.gov. And to support these questions, I'll also send something directly to DHCF.
And just so people know, we appreciate how rushed this feels at this point in time. But I was just I think I had mentioned last week, I was at the National Association of State Directors of Developmental Disability Services, and it feels similar across the country. And the response from CMS was that when they turned to Congress, they were told, we feel you've had enough time to implement this. No, there will not be another delay. So someone responded that the training today is visit capture. And it looks like there's other folks that also got theirs within 24 hours. So for people who didn't get theirs, you really might want to reach out. How do agencies get registered for the EVV training?
Yes, I've provided the link up on top of the chat where you can register for the training. Along with that link, it's basically it leads you to a notification letter that outlines the steps to take and which roles have to apply for what training. And I'll post it again.
There, I just did.
Okay, thank you. Trying to read the comments and do that.
Are DSPs going to this training? The question is this the same link for DSPs?
No, this is only for the role of the administrative staff that you designate to be the administrator, I'm sorry, and the office staff. DSP training is only a short video showing them how to use the system from the front end. So using the app and the calling in to do check-in and check-out if that's the option they have to do. Yes, and as someone confirmed, visit capture is today 1 to 2 o'clock. And also there was, I should say, scheduling training on the EVV training schedule for 10 to 10:45. And in that link I provided at the very bottom, if you scroll down, it details the training schedule as well. There it is. I was waiting for it. No, the question is, does EVV apply to companion services as well? At this time, it's not included in the phase 1 for EVV implementation. However, DHCF is aware that it shares some of the common same, I should say, traits as the other required EVV services, and this will be explored to be included in a phase 2. You're welcome.
So you see that, right, Donald?
Yes, our agency completed administrative training for alt EVV and have not received a toolkit. Has anyone else on this call using alt EVV received their toolkit? My understanding from DHCF is that alt EVV providers who choose alternative EVV do not have to go through all the trainings of providers who are choosing the district's EVV system. And primarily what alt EVV has to focus on is aggregator training. So my question that I'll pose to DHCF is that whether for aggregated training, how does notification look for alt EVV? Question is, you may have already answered this, but does EVV apply to providers of supported living with transportation services? Yes. Just to emphasize, supported living periodic with and without transportation.
So it doesn't seem that we have any COVID-related questions. I appreciate people's concerns right now about EVV. There is that email address where you can send those questions. I think you can also reach out to Donald with these questions, right? Is that fair?
Yes, I will be your advocate to get the answers.
And I'm also not seeing any groundswell for people having, for people not having a relaxing Friday, next Friday. So our next call will be in 2 weeks. I would encourage people to start Cyber Monday early and do your Christmas shopping online Friday rather than, my hope would be that people are not crowding into stores on Friday. And, my hope certainly is that everyone has a quiet, enjoyable Thanksgiving with the people in their household, and that we all stay safe and healthy. Perfect. Black Friday is now online, just like Cyber Monday. And that we all stay healthy into the new year. We hear lots of promising news about a vaccine. So our hope is that we all get to that. So if we have no more questions, people can enjoy their weekend and their holiday next week, and we will talk with everyone again in 2 weeks.